This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Yeah, you've heard what they say, smile and the whole world smiles with you. But what if you don't like the look of your smile? Yeah, you might not be striking that ear to ear, right? Bad or missing teeth may have you trying to hide them instead, but it doesn't have to be that way. Dentures have come a long ways. As a matter of fact, the folks at Delmarva Dental Services in Salisbury say that today's dentures are not like the ones that you saw in a glass at your grandmother's bathroom. Remember that?
Dentures, or false teeth as some people call them, have come a long way since George Washington had a set fashioned for him in the 1780s. Contrary to later legend, they were made of ivory, not wood. Today, dentures are made of acrylic materials and are a common part of practice here at Delmarva Dental Services in Salisbury.
There are 35 million Americans who are edentulous, meaning that they have lost all of the teeth in one or both of the arches of their mouth.
And it's not just older people who need full or partial dentures.
It can be, trauma causes people to lose teeth. Decay causes people to lose teeth. Financially, sometimes it's difficult to be able to do what's needed to save a tooth. And so, yeah, you find that people begin to lose one tooth or a few more, and then you are looking at replacing them with maybe something removable if a fixed replacement isn't an option for them.
Dr. Aki says there are 3 types of dentures. Complete dentures are used for patients who have no natural teeth remaining and the prosthesis sits or rests on the bone and gums. Partial dentures are for patients who have some of their natural teeth and the dentures are fabricated to replace the missing teeth while relying on the natural teeth for support and retention. Then there are overdentures. These utilize implants with a locator attachment or root canal treated natural teeth with attachments to help stabilize the denture. Since dentures are not one size fits all, fitting a patient for any of these options requires a series of appointments.
So it's a series of impressions. It follows that with what we call bite blocks, which is wax rims that we can actually determine the position of the teeth, how far forward they should be, how they should bite together, how wide they should be, where's the midline of the face. No one is symmetrical entirely. People's noses might be off to one side a little bit, their chin might be off to one side, you just never know. So we have to line that up. Choosing tooth color, tooth shape, tooth size, how big should they be?
In order to find the perfect tooth color, Dr. Aki considers several things, such as skin tone and even the whites of the eyes. The color is broken down further by variations within each shade family. They include hue, saturation, and lightness.
If possible, we do what's called a wax try-in, where we actually get to look at what it's going to look like before it's the final product, so we can make some changes from there.
Once a patient gets their final set, it may take a little getting used to.
Wearing a denture is not always an easy thing. It is not the same as having real teeth, and there definitely is a period of adaptation. So you're fighting dry mouth sometimes. That can be difficult. You could also be fighting the floor of your mouth, swallowing, your tongue raises, your tongue moves, your cheeks move. When you speak, when you open wide, you could risk things maybe falling out if things aren't adjusted properly.
Dr. Aki says depending on how long you went without teeth, your bone structure could have changed, affecting the ability to hold dentures in your mouth securely. But with the right care in selecting custom dentures and the proper maintenance of the dentures, patients can face the world with a whole new smile.
We can really do a lot as far as creating almost a smile makeover, even with a denture or a partial.
And that, in of itself, is something to smile about.
Isn't that absolutely amazing? That, of course, was Lisa bringing us that story. Now, if you've been wearing dentures for years, maybe they're starting to show their age. Guess what? You can get new dentures without having to get new impressions. Delmarva Dental Services can actually do an impression of your current dentures to make your new ones. Would you like to read more about Delmarva Dental Services and the services they offer? All you have to do is go to delmarvalife.com.